So picture this. You've got a Pembroke Welsh Corgi, and we are going to look at three very distinct moments across this dog's life.
Okay, I love this setup.
Right. So first, you have the puppy phase. This tiny, incredibly energetic little potato is just chasing your feet, fiercely mouthing a pant leg, doing some serious detective work with his nose just to hunt down a single dropped crumb on the kitchen floor.
Oh yeah, they're relentless with the crumbs.
Exactly. And then mid-thought, he just collapses into a deep sleep.
It's a very specific, chaotic kind of joy, honestly.
Yeah.
And that pant leg nipping, it isn't just random puppy energy either.
It's not.
No, you are watching hundreds of years of Welsh farming genetics at play there.
Yeah.
I mean, they were bred to move 1,000-pound cattle by literally dodging hooves and nipping at heels.
Wow, which really explains the sheer audacity of the breed. But then you fast forward a few years to the adult version.
Right, the prime years.
Yeah, he's walking confidently, he's clocking the front door for any potential intruders, and he is waiting near the kitchen at exactly the right time every single evening. It's like his internal biological clock is somehow tied to the rotation of the earth when it comes to his dinner.
Flawless. And they're entirely unforgiving if you happen to be even like 5 minutes late.
So true. And finally, we look at the senior version of this exact same dog. He rises a little slower from his bed. He chooses the shorter route on his walk.
Yeah, slowing down a bit.
Right, and he actually pauses at a step that he used to just fly down without a second thought. But the second he hears that kibble hit the bottom of the food bowl,
Let me guess.
he is right there, practically vibrating, fully invested.
That right there is the key to this whole deep dive.
Yeah.
Because we are looking at the exact same dog. He has the same bright, incredibly opinionated, and intensely food-obsessed personality the whole way through his life.
Yeah, the core of who he is doesn't shift at all.
Exactly. The underlying architecture of his mind hasn't changed. What actually has to change isn't the dog's core identity. It's what you, the owner, are watching for.
Okay, let's unpack this. Because whether you are a longtime Corgi owner or you're just, fascinated by how different breeds function, this deep dive is going to completely reframe how you observe the animals in your life.
It really changes your perspective.
It does. And our mission today is not to terrify you by making you memorize some massive encyclopedia of canine diseases. The mission is to build a repeatable habit of noticing.
Because what a dog needs shifts dramatically over time. But those shifts are so subtle.
Yeah.
Puppies need safe, structured development.
Right.
Adults need sustainable daily habits. And seniors, well, they need adaptation and a real focused attention on their physical comfort.
Which makes total sense.
Yeah, and if you understand the mechanisms behind those overarching themes like the why and the how of their bodies, you don't need a veterinary degree to give them a spectacular life.
So we need to start with the absolute foundation, which is the stuff you notice every single day without even trying. But paradoxically, we also need to address why the most obvious signal a dog gives you, which is eating their food, can actually be a massive trap for a Corgi owner.
Oh, the food trap. Yeah, daily life is your ultimate baseline.
Right.
When you live with a dog, you are constantly absorbing data without even realizing it.
Like what kind of data?
Well, you see how he gets up in the morning, how he shifts his weight walking to the door, how much he drinks, his bathroom habits, and, how he settles down at night.
Right.
The goal here is simply to know what is normal for this specific dog, because normal is highly individual.
So you're basically establishing a control group of one.
I like that. Yes, You establish that baseline so you can spot when something sticks around or starts degrading. Like if he always stretches his back legs a certain way when he wakes up and then stops doing that stretch for 3 days, that's not just a quirk.
It's data point.
Exactly. That's a data point.
I want to dig into the food bowl aspect, though, because I have a theory here. To me, a Corgi's appetite is like a check engine light that's been taped over.
Oh, wow. That is a great analogy.
Thanks. I mean, usually a strong appetite is the ultimate sign of health in dogs, right? If they're eating, we just assume their systems are running fine. So why can't we trust an empty bowl with this specific breed?
A taped-over check engine light is the perfect way to visualize it. Corgis are so notoriously food-driven that they will enthusiastically eat right through conditions that would cause other dogs to go on a total hunger strike.
Really? Like even if they're in pain?
Oh, absolutely. This goes back to their working genetics. A herding dog on a farm cannot afford to show weakness, or they lose their place in the pack, or they get injured by livestock. They are incredibly stoic animals.
So they just power through it.
Yeah, add that stoicism to a basically bottomless stomach, and they will eat through severe dental pain. They will eat through systemic illness. I mean, they will eat through intense joint discomfort.
Wow. They are just so committed to the survival mechanism of the meal that they completely override their own pain receptors.
They override them constantly. So a strong appetite in a corgi is good information, but it is absolutely not proof of complete health.
That is so counterintuitive for most dog owners.
It really is. If you just look at an empty bowl and think, oh, he must be fine, you're falling into the appetite trap.
So if we can't rely on the empty bowl, what are we actually supposed to be watching for at mealtime?
You have to look at the mechanical friction of how they are eating. Like, are they suddenly dropping kibble from their mouth?
Oh, like they can't hold it in?
Right. That points to jaw pain or a tooth issue.
Mm-hmm.
Or are they chewing exclusively on one side of their mouth? That's a classic sign of a tooth root abscess.
Oh, ouch.
Yeah. Are they having trouble crunching, or are they just swallowing food whole when they used to chew it?
And what if they're eating way more than usual?
On the flip side, an extreme sudden increase in appetite can signal metabolic issues like Cushing's disease. The subtle behavioral mechanics matter far more than the final result of a clean bowl.
Interesting.
What's fascinating here is that behavior changes in general are very often medical signals, not just training issues.
Yeah, the source material emphasizes this heavily.
Uh-huh.
If you have a dog who suddenly starts withdrawing or gets irritable or growls when you lift them or is suddenly restless at night, like pacing the floors, those are often medical red flags.
Yeah.
Same with starting to have accidents in the house. A dog doesn't just wake up one day and decide to be stubborn or forget their house training.
That is such a crucial mindset shift for any dog owner. When a dog's behavior changes abruptly, they're trying to communicate that their internal environment has changed.
And since we know a corgi will use food to mask their pain, we basically left looking for other physical tells.
Exactly.
Which brings us to the most visible tell we have, how they move.
Movement is the most critical recurring theme for this breed. And it all comes down to their unique architecture.
The long dog shape.
Right. They have a very specific condition called achondroplasia, which is the genetic dwarfism that gives them those short, sturdy legs. But they also have a long, heavy spine.
So biomechanically, they are basically a suspension bridge, but the support pillars are incredibly short and the bridge itself is quite long.
That's the exact physics of it. The mechanics of how they move are uniquely stressed. Every time they jump or twist, there is abnormal shear force being placed on that long spine.
I have to ask a probing question here, though. Since corgis naturally have this low-to-the-ground build, isn't a quirky walk or a slight waddle just, part of the corgi charm?
So tempting to think that.
Right. How are we supposed to distinguish between a breed trait and a genuine medical red flag?
Well, it's a dangerous assumption to romanticize a mechanical struggle. Yes, they have a unique rolling gait because of their wide chest and short legs.
The waddle?
Yeah, the waddle. But stiffness, limping, crossing the hind legs while walking, or showing hesitation at a step, those are never just a corgi thing.
Wow, okay.
Those are signs of pain, joint degradation, or neurological weakness.
So if they start doing a little bunny hop up the stairs, where they use both back legs at the same time instead of alternating, we shouldn't just laugh and say it's cute.
Never write off a bunny hop as charm. That hop is a compensatory mechanism. They're using both legs together because it hurts too much to put their full body weight on a single back leg to push up the stair.
That makes total sense.
But I do have to caution against immediately panicking. If you see a weird step, don't instantly assume your dog has a major spinal issue.
Right, because the sources mention some pretty scary-sounding conditions like IVDD and degenerative myelopathy.
Yeah, they do.
We shouldn't jump straight to the worst-case scenario, but we should probably understand what those actually are.
Let's break them down so they aren't just scary acronyms. IVDD stands for intervertebral disc disease. Think of the discs between their vertebrae like little jelly donuts acting as shock absorbers.
Jelly donuts, got it.
Because of that long spine we talked about, those donuts take a lot of wear and tear. Over time, the outside can get brittle, and the jelly inside can bulge or burst out, pressing directly on the spinal cord.
Oh, that sounds awful.
It is. That causes immense pain and can lead to paralysis.
And what about degenerative myelopathy?
Degenerative myelopathy, or DM, is essentially the canine equivalent of ALS or Lou Gehrig's disease.
Oh, wow, that's serious.
It is. It's a genetic condition where the myelin sheath, the protective coating around the nerves in the spinal cord, slowly degrades.
Like a fraying wire.
Exactly like a fraying electrical cord. The brain is trying to send a Wi-Fi signal to the back legs to tell them to move, but the signal gets weaker and weaker.
But does it hurt them?
No, it's
No.
painless, but it causes progressive weakness in the hindquarters. And then there's hip dysplasia, which is just a poor fit between the ball and socket of the hip joint, causing friction and arthritis.
Those are serious conditions, but our job as owners isn't to diagnose them. Our job is just to notice the symptoms and document them.
Precisely.
Which brings up a really brilliant tactic from the source material, the safe movement
Oh,
video.
this changes the game for your vet. When you take your dog to the clinic, they are flooded with adrenaline. It's a new environment, there are weird smells, and that survival instinct kicks in.
So they act totally fine in the exam room.
Yes, a dog that has been limping at home all week will suddenly walk perfectly on the examination table because they are masking the weakness.
The adrenaline literally overrides the limp.
It really does. So you need to capture authentic data.
Mm-hmm.
Take a video of your dog during a natural walk in their normal environment.
Just on your phone.
Yep. Film from the side so the vet can see the length of their stride, and then film from behind them so the vet can see if their hips are swaying unevenly or if their paws are crossing.
But the source comes with a very strict warning here.
Oh.
Never, ever provoke pain just to get better footed.
Absolutely not.
Like, don't force them up a flight of stairs if they are hesitating, just because you want to show the vet how much they are struggling.
Never intentionally cause pain for a video. And honestly, don't delay going to the vet just because you haven't captured the perfect cinematic shot of the symptom.
Good advice. Now, while we are talking about movement, there was this one detail in the research that completely reframed how I look at dog paws. The nail clue.
Oh, this is the ultimate example of granular noticing.
The source notes that if just one rear nail starts wearing down differently than the others, like the middle nail on the back left paw is suddenly flatter or shorter, that is vital medical information.
Yes.
It is not just that they need a pedicure.
It's a brilliant diagnostic clue because physics doesn't lie.
Yeah.
Going back to that fraying electrical cord analogy, if the nerve signals to that back foot are slightly delayed, the dog's brain doesn't tell the leg to lift quite high enough during the swing phase of their walk.
So the top of that specific nail gently scrapes against the concrete with every single step.
Exactly. The dog might be actively hiding a limp from you, but they cannot hide the physical friction on the nail.
That is wild.
If you notice an uneven wear pattern while you're wiping their paws after a walk, you have caught a neurological or gait issue very early, well before it progresses into something much more difficult to treat.
Catching those subtle movement issues requires the dog to have healthy joints and healthy muscles to support that suspension bridge spine, right?
Right.
But evaluating a corgi visually feels completely impossible. To me, their double coat is like wearing a puffy winter jacket over a broad, solid frame. It basically hides all the evidence of what's happening underneath.
Oh, the Corgi coat is an incredible piece of genetic engineering. It's a double coat, meaning they have a harsh, weather-resistant outer layer of guard hairs and a dense, soft undercoat that insulates them.
Which is great for them.
It keeps them warm in the winter, it repels rain, but it also creates a massive optical illusion. You cannot just look at a Corgi from across the room to see if they're at a healthy weight.
Because the fur fills in all the visual dips and curves.
Exactly.
So how do we actually know if they are in good shape?
You must use the hands-on check. You have to get your hands physically under that puffy winter jacket.
Literally feel for it.
Yes, you need to press through the fur and feel their ribs. You should be able to feel the ribs easily without pressing hard, kind of like feeling the bones on the back of your hand.
Okay, that makes sense.
And you need to feel for a defined waist tucked up behind the rib cage. It is incredibly common for owners to grossly underestimate a Corgi's weight because that thick fur hides a disappearing waist perfectly.
Here's where it gets really interesting, though, because I'm stuck on this idea of muscle versus fat. If I take my dog to the vet and the scale says he weighs exactly 28 pounds year after year, why does it matter what the composition of that weight is?
Because a dog's overall weight on the scale can stay exactly the same pound for pound while they're secretly losing muscle in their hindquarters and replacing it with fat.
And fat doesn't hold the spine together.
No, it doesn't. Muscle is active tissue. It's the structural support for the entire skeleton. If the muscle in their thighs and over their shoulders atrophies, their spine is suddenly taking on way more impact and strain with every step.
Which is bad news for that long back.
Very bad news. The scale at the vet's office will tell you the total mass, but your hands tell you the structural integrity. You have to track muscle tone completely separate from weight.
And while we're doing this hands-on check, the source makes a great point. This shouldn't feel like a scary, sterile medical exam for the dog.
Oh, definitely not. Fold these checks right into regular couch time. While you're petting them, intentionally run your hands over their chest and legs to track any lumps.
Just casual checking.
Right. Note their size, their texture, whether they move under the skin or feel attached. Check their ears for a yeast odor, or if they suddenly pull away when you touch the base of the ear.
What about their eyes?
Watch their eyes for sudden squinting, cloudiness, or redness.
Mm.
Eye issues in dogs can deteriorate from a minor irritation to a serious ulcer in a matter of hours, so they require very prompt attention.
Wow, hours. Okay.
Yeah.
I want to touch on the skin, too, because I feel like the second a dog starts scratching their belly, the immediate cultural reaction is to assume it's a food allergy, throw out all the kibble, and buy something ridiculously expensive.
It's the most common leap in logic, and it's usually wrong.
Really?
Yeah, food allergies are actually quite rare compared to environmental allergies. And it could be pollen, it could be a contact allergy to a new rug cleaner, it could be parasites like a single flea bite setting off a reaction, or even a minor bacterial skin infection.
The source outlines a very strict rule for dealing with the itch. Never change their food, their shampoo, and their supplements all in the same week.
If you change 3 variables at once and the itch goes away, you have ruined your own experiment.
Because you don't know what worked.
Exactly. You have literally no idea which of the 3 things actually solved the problem. Was it the expensive new food, or did the oatmeal shampoo just soothe the skin?
Right.
You have to change one variable at a time, wait a few weeks to observe the data, and then move on to the next. It's basic scientific method applied to pet care.
So we've established how to observe their appetite, remembering the taped-over check engine light. We know how to watch their biomechanics and look for things like the worn-down nail. And we know how to bypass the puffy winter jacket of their coat to check their true body condition.
Yep, the physical baseline.
So how do we apply this system of noticing as the dog moves through its life cycle?
Well, it's all about adapting to what their body is capable of in each phase. In the early days, puppies need steady, slow growth. You do not want forced, rapid size.
Because their growth plates haven't closed yet, right?
Correct. Their bones are lengthening, but
Yep.
the ligaments and muscles haven't fully anchored everything down. If a long-backed dog grows too fast or puts on too much weight as a puppy, it places terrible strain on those developing joints. They also need safe socialization, and you have to actively redirect that natural instinct to nip at your heels.
Because you can't train the herding instinct out of them.
Right, but you can teach them what is appropriate to herd.
And then they hit the teenage phase.
Ah, yes. The adolescent stage is tricky because they look like fully grown adults, but they completely lack coordination and physical pacing.
Like most teenagers, to be honest.
Exactly. Their endurance hasn't caught up to their enthusiasm. You have to require gradual physical conditioning. You can't just take an adolescent corgi on a 5-mile mountain hike on a whim,
You have to build their stamina.
just like a human runner would.
But let me push back on this a little bit, specifically regarding how they age. We keep talking about corgis as working dogs with incredibly high alertness and persistence. Do we have to completely suppress that working dog personality as they age into seniors? Or is there a way to let a senior corgi still work safely without breaking their back?
If we connect this to the bigger picture, the behavioral blueprint of a corgi, that alertness, the barking at the window, the extreme sensitivity to movement that never disappears.
It's hardwired.
It is hardwired. You cannot suppress it. And trying to force a working dog to become a passive couch potato will just create a deeply frustrated, anxious animal.
So what do we do when their aging bodies can't keep up with their sharp working mind?
Instead of a full stop in old age, they need adapted participation. You still give them jobs, but the jobs shift from physical labor to mental labor. And this ties directly into how we manage their nutrition.
Using food as a tool, since their appetite never fades.
Exactly. Because their food motivation is permanent, you use it as leverage. You use their kibble for training tricks, for puzzle toys that tire out their brain, and to make vet visits cooperative.
Oh, that makes sense.
But the vital detail is to count those puzzle treats towards their total daily caloric intake. Older dogs have slower metabolisms. If you just add treats on top of their normal meals, they will gain weight rapidly.
So you have to deduct the paycheck from the daily kibble allowance.
Perfectly said.
And for exercise.
Adulthood should be about variety walks, gentle play, maybe some low-impact agility. But as they age, what you are really monitoring is not how enthusiastic they are during the activity.
Why not?
Because a working dog will push through severe fatigue since their drive is so high, you need to watch their recovery afterward.
Okay, recovery.
If they go for a long walk and seem to be having a blast, but then they can't comfortably get up from their bed for the next 4 hours, that activity was too hard. The recovery dictates the safety of the exercise, not the performance.
Watch the recovery, not the performance. That is such a crucial distinction. Now, taking all this observational data to the vet, the source text is really specific about bringing hard evidence rather than just vague concerns.
Oh, it changes the entire dynamic of a veterinary appointment. Vets usually have 15 minutes to figure out what's wrong.
That is not a lot of time.
It's not. So bring a concise, written timeline of any behavioral or physical changes. Bring the exact brand names of their diet and supplements. Bring those safe movement videos we talked about. And if you have done genetic testing, bring those DNA records.
But on the DNA point, this source offers a really important caveat about not overreacting to test results.
Yes, an at-risk DNA result is just context.
Just context.
Let's take von Willebrand's disease, for example, which is a condition some corgis carry where they lack a specific protein needed for blood clotting.
Okay.
If your dog has the genetic marker for it, it doesn't mean they are spontaneously bleeding. It just means the genetic potential is there. It helps your vet know they should run a quick clotting test before a major surgery, but it is not an active diagnosis of illness.
That's a huge relief. It's just context. But there are times when we shouldn't just be taking notes and gathering context, right?
Right.
The source draws a very hard line on emergencies.
Yes. If you see a sudden inability to walk, severe breathing trouble, a sudden bloated and hard abdomen, or repeated seizures, that means zero home treatment.
Don't wait it out.
No. You do not wait and see if they feel better in the morning. You go to the emergency vet immediately.
So what does this all mean? We've traced this amazing, stubborn, food-obsessed working dog from puppyhood to their senior years.
Quite a journey.
It is. And what I'm taking away from all this research is that protecting a corgi's compact athletic body and their sharp mind doesn't require paranoia. It just comes down to structure, understanding their physical mechanics, and maintaining consistency on totally ordinary days.
You don't need a crystal ball to predict every single disease. You literally just need to know your dog well enough to spot the difference when their base life shifts.
Exactly.
This raises an important question, though, and it's something the source text really inspires you to think about on a much deeper level.
Oh, yeah.
Think about the actual skill set we've just spent this time discussing. If we train ourselves to pay this level of quiet, granular attention to an animal's daily habits, if we can learn to notice a single worn nail on a back paw, or recognize a subtle hesitation on a stair, or understand that an empty food bowl might be masking physical pain,
Right.
how might that radically alter and improve the way we observe the human beings in our own households?
Oh, wow. Does mastering this system of noticing for a stoic, nonverbal dog actually train us to be vastly more empathetic partners and parents?
It forces you to look past the obvious signals. If you can notice a subtle shift in how your dog rises from a nap, imagine what you could notice in your spouse's body language after a tough day, before they even say a word.
That is so true.
Or recognizing when a child's sudden shift in behavior isn't them just being stubborn, but a signal that something deeper is bothering them. It is the practice of paying true, focused attention to the ones we love.
To circle all the way back to our opening, whether it's the chaotic puppy chasing your shoe or the gray-faced senior waiting by the food bowl, the dog never stops being exactly who they are. The only thing that changes is how closely and how thoughtfully we are willing to look. Keep noticing. We'll catch you on the next deep dive.